Hi, so I'm Sam. I'm the co-founder and CTO of Pretect Devices. So I'd like to ask a question. What is the most vulnerable thing or delicate thing that you've ever held in your hands? So for my co-founder and I, it was our prematurely born daughters who were fighting for their life in the NICU. So in that hidden world of the NICU, which can be like a war zone, IV line integrity is critical for survival. The leakage of IV fluids cause terrible chemical burns, and the only way that's being prevented is hourly checks by nurses, which is a visual check. And these injuries they require surgeries, they cause scarring and disabilities, and even amputation in some cases. Okay, and so sorry, I should have done the trigger warning first, but so that's where VDEC comes in. So we're producing a optimized continuous IV monitoring device, and this is designed specifically for our smallest and most vulnerable patients. And so my co-founder's been an astrophysicist for 15 years, and she's using the same techniques that she used to detect tiny cosmic signals in a noisy space background to detect tiny changes in tissue properties. And it's already working. So we're detecting down to 0.1 mil of leakage, which is 40 times more sensitive than our best competitor in the market. And as you can see in the IV site, in the NICU, to maintain workflow, you need to see all this skin. It's a visual window. Our competitor covers this with a sensor, and it can't detect cloudy fluid. The most commonly administered fluid in the NICU is very cloudy and caustic, and it's nutrition. They can't detect on darker skin tones or in high light levels. So our device detects for all patients equally, and it maintains this window of visibility. It doesn't cover anything. It's out of the way, which is important for the NICU. They have a very optimized workflow. So what happens when a leakage is suspected is resighting, and this can take 10 to 30 minutes. But for critically ill patients, like septic patients or those requiring cardiac drugs, this can cause hypovolemia and shock and mortality. So we don't just detect full leakages, but partial leakages, and we can give an indication of how much time there is until there's an inevitable injury, which maintains that IV flow. It allows them to set up the second site and keep that IV fluid going. We're also tuning our device to detect infection, local and systemic infection, in other words, sepsis. And sepsis is responsible for 30% of the mortality in the NICU. And so the current, we can also detect at the old IV site. So that's another area of infection. So we can leave our device there and detect on both sites. So the current market, just for the NICU, just for extravasation in Australia, is 30 million a year, 40 million pounds in the UK, and 500 million USD in the US. And that's to do with preventing the injury and reducing costs and resiting costs. And so what usually happens is technology is scaled down from the adult population for the NICU, and it's not fit for purpose. We're designing our device for the NICU specifically, so it's hypersensitive. That means scaling up is very easy, and it creates a strong performance barrier. And we've already had interest from large markets, including anaesthetists and contrast imaging and iron infusion, where when there's a leakage, it causes a large discoloration of the skin for a long, long time. And so we're already partnered with neonatal networks and NHS Trusts and some top innovation hubs in the US. So we're going to bring this worldwide. And so this mission is personal for us. Our babies survive the NICU, so they're healthy. Many don't. So we've got the tech, the patents. We've got a clear path to market and good partners. If you're a high-impact investor and you want to improve the global IV safety standard and prevent sepsis and extravasation injury and empower doctors to make a more objective, data-driven decision instead of a delayed, subjective decision, then please come and talk to us. We'd love to hear from you. And just quickly, that's my daughter there. I'd just like to show her off because I think she's cute. So. Thank you. Thank you.
And yeah.